Good morning to everybody. Me Nath Ghimire. Me from Gauri Shankar campus, Nisgad Bara. पेसाले I am teacher. म teacher हूँ. मलाई teacher भन्नमा गर्व छ. Thank you. I am presenting impact of the healthcare services on human health in Nepal. Introduction. According to WHO, health is a state of complete physical, mental, and social well-being, and not merely the absence of the disease. Human healthcare service is wide area of activities and resources aimed at promoting, maintaining, and restoring health, including preventive care, treatment, and rehabilitation delivered in various settings like hospital, clinics, and even at home also. Health for all, it is started from the 1978 Alma-Ata Declaration. I'm not explain this one because all are known about it. Statement of the problem. Many low-income countries lack sufficient healthcare facilities and health personnel in rural and remote regions compared with urban area. Healthcare facilities are often lacking of equipment, medicine, and laboratory services. Most healthcare workers prefer to work in urban setting due to the greater opportunities and high salaries. In rural and isolated regions, people tend to trust traditional healing practices. They first seek out healers for conventional remedies before approaching a health organization for medical treatment. Still, the first time traditional treatment go to all the people in the rural area, then go to the health post. The prolonged duration before reaching a health post result in a decline in their health status. When they become worse condition, then go to the hospital or health post. Treating chronic disease requires both time and substantial cost for specialized treatment, transportation, and lodging expenses increase, making healthcare more expensive for individuals in rural and remote areas compared to those in urban areas. Those people who are come from the rural area for the treatment in the city area, they use transportation and lodging also, so it is more expensive to the rural area. Objective to examine and evaluate published article on health services and personal experiences between urban areas and rural area of the Nepal. Methodology, the researcher used scientific review process as a meta-synthesis to find a solution regarding the effect of health service in rural and urban area. The review was carried out systematically through the gathering of research article alongside report and data of the health services are available on health personnel in rural and urban area. Findings: a sufficient number of skilled and motivated health workers in appropriate location and at the necessary times is essential for providing effective health services and enhancing health status. A lack of qualified health workers in remote and rural regions obstruct access to healthcare services for a considerable proportion in the population. Socio-economic challenges, including level of poverty and elevated unemployment rates, are among the barrier of obtaining healthcare services, leading to adverse health outcomes. In rural regions, inadequate infrastructure and road conditions hinder access to a health center. In the Asia, the Pacific reside in rural and remote area, population encounter a significant challenge in offering sufficient access to hospital care for urgent and specialized treatment. In sub-Saharan Africa, the ratio of traditional healers to the population stand at 1:500 and the doctors ratio is 1:40,000. Hospital health personal status of the Nepal. There is a 17,232 total health facilities, including hospital, primary health care centers, and health works. Nepal, according to Nepal Medical Council, there is registered 1,55,650 health personnel. Among them, doctors are 34,910, nurses are 82,471, NM are 37,420, and foreign nurses are 849. If we have see ratio of the doctor 1:835 and nurses 1:47 give services to the Nepalese people. Conclusion: sustainable strategies and policies need to be incorporated to enhance access to healthcare services in rural and remote regions, even in most low-income nations like Nepal. There are traditional healers and alternative healthcare providers more unreachable in rural area. However, ill individuals still relate to the divine. Residents of the rural communities first consult traditional healers and offer cow, egg, and goat to worship for divine control, then go to the health for treatment. Modern health services and personnel are more readily available in the rural area. Thank you.